So here the list of herbal medication, the name, their uses, and some NCLEX note. What is frequently asking by NCLEX PN and NCLEX RN board exam. So the first herbal medication we use called aloe vera. It is most commonly used, and everybody know what is aloe vera. So aloe vera has some properties. This is the reason we use it. They are anti-inflammatory effect. Because of their anti-inflammatory effect, we use aloe vera for burn or any kind of abrasion or wound on the skin. Sometimes they helps with the tissue injuries. But if we use the aloe vera, we need some information about aloe vera, like aloe vera can cause GI upset. GI upset means nausea, vomiting, or diarrhea. So if you give the aloe vera and if your patient take the medication called digoxin, it is important inform them aloe vera can increase the digoxin level. Here's something very important I want to share with you. The digoxin is a cardiac glycoside. Digoxin we use for atrial fibrillation or atrial flutter and also used for chronic heart failure. The digoxin has a narrow therapeutic index, right? So if increase the digoxin level, it is not good for the patient because digoxin has some side effect. To avoid it, we could check the digoxin blood level. The next herbal, it is called Echinacea. Echinacea is a blood purifier that fight against the cold or infection or cancer, right? So basically, Echinacea used to improve the immune system. So if your immune system is stronger, it would be easy to fight against bacteria or any infectious agents, cold, right, or cancer. So Echinacea is used to improve the immune system. But there are some contraindications. What they are? The most important one, if your patient is a pregnant or if the mother under breastfeeding, so pregnant and breastfeeding women are not allowed to take Echinacea, right? Because they have some of the side effect like liver toxicity or renal toxicity, right? And also Echinacea is not effective with the patient who are HIV positive. So immunocompromised, you see, not good for them. Like HIV patient is immunocompromised. Organ transplant patient is immunocompromised. They are not a good candidate for use the Echinacea. Another most common herbal medication we use is called Ginseng, right? Ginseng we use for anemia or we use for hypertension, and also we use for benign prostatic hyperplasia. So here it is very important. Ginseng root used to improve the immune function and also act on the central nervous system, and which will stimulate the energetic response. But also keep in mind, Ginseng we use for hypertension. But I said, it is not good, or ginseng should not be given to the patient who is already diagnosed by hypertension, or ginseng should not be given to diabetes mellitus patient, because blood glucose level chance to go drop, right? But most of the people use the ginseng because of benign prostatic hyperplasia, means prostate gland enlargement. So what is contraindication of ginseng? If your patient has a hypertension, diabetes mellitus, or clotting disorder, we will not give ginseng. They may increase the effect of stimuli, or if your patient go for any kind of surgical operation, we could hold 7 days before surgical operation, because the ginseng interact with blood thinner. Like if you give ginseng and coumadin, warfarin together, increase the bleeding time, or increase the effect of in blood blood thinner or anticoagulant. So we always hold it, right? So a common question NCLEX board asks, ginseng will increase the risk of hypoglycemia. Very important for NCLEX board. Another common question NCLEX board asks, an easy way to remember, the herbal medication start by the G, letter G, like ginseng or Ginkgo biloba or ginger, right? Or garlic. Let me recap it, my friend. The herbal medication, they started by the letter G, like ginseng, like Ginkgo biloba, or garlic, or ginger. They always interact with blood thinner. They always interact with warfarin, coumadin, or heparin. So ginseng or Ginkgo biloba or ginger or garlic never give with blood thinner together, because they increase the bleeding time, they increase the effect of blood thinner or anticoagulant. The next drugs herbal we use is called St. John's wort. St. John's, right? The St. John's wort we use to treat the depression, or use for the anxiety. So the St. John's wort used for wound healing, women who has menstrual disturbance, diuretics, or depression. In a short, I said St. John's wort we use for depression and anxiety, because this is the question NCLEX board frequently asks. Now, what are the other question NCLEX board asks? I want to share with you. If your patient took the St. John's wort, they should avoid the sunlight. Why? Because they are photosensitivity effect. they causes the photosensitivities, right? So again, I said, if your patient take the St. John's wort, tell them not to take blood thinner like coumadin, because St. John's wort decrease the effect of coumadin, and St. John's wort increase the photosensitivities. Tell them not to go under the sun. And also, St. John's wort interact with antipsychotic, is called SSRI. They interact with antipsychotic, right? So what wrote here? Let me read it. So avoid the sunlight. It is used as an antidepressant, or also St. John's wort and antidepressant not to give together. Avoid hypertension also with immunosuppressant. Also avoid the food containing tyramine. So this is the another most common question NCLEX board asks. St. John's wort and tyramine containing food not together. If you ask me what are the food list contain the tyramine, I could tell you some kind of meat or some kind of grain or some vegetables like banana, avocado, raisin, or some dairy food like cheese or coffee, chocolate, or soya sauce. They contain the tyramine. So tyramine and St. John's wort give not to give together. So next medication, herbal medication called Kava, right? Kava we used to treat insomnia and muscle pain, decrease the anxiety and stress. I am adding you Kava we use for treat the insomnia and muscle pain as well with anxiety and stress. But Kava interact with barbiturate. Barbiturate we also use for anxiety. Another herbal is called Ginkgo biloba. Ginkgo biloba increase the blood circulation, improve the attention span, and takes 6 to 8 weeks to see the result. So if you take Ginkgo biloba today, you have to wait for 6 to 8 weeks to see the result, right? So here is important, they may cause central nervous system depression, cardiac arrhythmia, contraindication with gallbladder disease, may increase the bleeding with coumadin. So I said, if any herbal medication start by the letter G, they always interact with blood thinner. Like coumadin is a blood thinner, right? Also use with caution with patient diabetic mellitus, antihypertensive, and cardiac medication. If I make short, okay, if I make short here, so here I said, so Ginkgo biloba increase the effect of monoamine oxide inhibitor, or avoid. It is good to avoid if your patient take dilantin and Ginkgo biloba not to give together. And also hold 36 hours before any kind of surgical operation. Sometimes ginkgo biloba student eat or drink or take because they believe ginkgo improve the memory, right? Also keep in mind, ginkgo biloba, do not take it if your patient have a history of seizure. Never give it. Another medication here is called ginger. So ginger most commonly used to treat the burn or motion sickness, nausea or burn, right? So contraindication of ginger if your patient have a gallbladder disease. So ginger may cause central nervous system depression or gallbladder disease, or may increase the bleeding of coumadin, or cause with, if you give the patient, you have to use some precursor if your patient has a diabetic or hypertensive crisis or cardiac medication. Again, keep in mind, NCLEX board frequently asks a question: ginger do not give or take if patient has a deep vein thrombosis. Another herbal medication we use is called garlic, right? It is commonly used, garlic. So garlic may decrease the cholesterol, may decrease the blood pressure or blood glucose level. They have a antibacterial properties or antifungal properties. Garlic also improve the circulation, right? Again, I want to recap it. They lower the blood pressure, they lower the cholesterol level, they lower the blood glucose level. They have an antibacterial effect, antifungal effect. But keep in mind, if your patient already diabetic, if your patient already take anti-diabetic medication, that times garlic is contraindicated because garlic can interact with anti-diabetic medication. They can interact with blood thinner, right? So let me read it. May affect blood clotting, blood sugar level, avoid with diabetic medication, may increase the bleeding with coumadin. So garlic and coumadin not together. Garlic and antihypertensive not to give together. So palmetto. So palmetto supposed to help or promote the prostate and improve the urine flow. They have an anti-inflammatory effect. They prevent the hair loss, right? So no drugs interaction may cause stomach upset. So again, I want to recap it. So palmetto used for prostate disease or improve the urine outflow. They have an antibacterial function. They prevent the hair loss. Usually, saw palmetto, no drug interaction, but they cause the stomach discomfort. Another medication we use, herbal, Valerian root. Valerian root claim the neuro system or promote the sleep. So in case of insomnia, we can use the Valerian root, right? Overdose may cause nausea, vomiting. Valerian root may increase the sedation. or when used with ethyl alcohol. So Valerian wrote an ethyl alcohol not to give together, or not to give with barbiturate or benzodiazepam, right? Or sleeping disorder, because they cause drowsiness, right? Another one is called black horse. So black horse, we use the menopausal syndrome, right? Like hot flushing. So used to the menstrual or menopausal symptom, used as a sedatives or diuretics, or reduce the blood pressure or hot flashes, night sweat or mood changing. What are the contraindication? Black cohorts contraindicated with heart congestive heart failure medication, or black cohorts contraindicated with pregnancy, right? So let me read it. Overdose may cause nausea, vomiting, headache, dizziness, contraindicated with heart failure medication or pregnancy, and also affect use of hormone replacement therapy. Another one is called feverfew. Feverfew used for migraine, headache, or arthritis pain. Increase the effect of Coumadin, contraindicated in pregnancy. And licorice used for peptic ulcer or GERD. GERD stands for gastroesophageal reflux disease. Weight loss, right? So contraindication of the heart disease may increase the blood pressure. Also avoid with the antihypertensive medication, especially SCE inhibitor, angiotensin converting enzyme inhibitor with steroid and digoxin, right? So it is very important to prepare during the exam time. Another question frequently exam NCLEX board asks, like I said, if your client is on suicidal ideation for and you are watching the patient for suicide for the life-threatening statement, she refused to be social. However, he's complained with the old medication. When you giving them, always keep in mind, St. John's wort can cause severe depression or suicidal ideation. So I said the St. John's wort here, this medication, St. John's wort, they can cause severe depression and suicidal ideation. It is very important. If anybody or any patient can St. John's wort, we have to monitor them, right, to prevent the suicide.